There's a long list of conditions that can cause blood in the urine, and that could be either visible blood or microscopic blood that's picked up by a urine test, for example. If you think of the urinary system being made up of kidneys, the tubes that carry the urine down to the bladder that we call ureters, the bladder itself, and then the water pipe that carries urine to the outside. Any condition that affects those parts of the urinary system or the urinary tract can cause blood in the urine. Often blood in the urine will be a benign, non-serious condition. For example, a urine infection that can be diagnosed in a straightforward way and treated, for example, with a course of antibiotics. But there are other causes, and some of the serious things that we are concerned about would be cancerous growth either in the bladder or other parts of the urinary tract. There are some differences that can be a cause for that. For example, it is thought that women would encounter urinary tract infections more often than men, and that could be one of the causes for blood in the urine, for example. In men, enlarged prostates, especially men who are older than 50, can be one of the causes to see visible blood in the urine. And again, that's usually a self-limiting problem that doesn't require any intensive treatment, but we mustn't forget that the most important part or cause for blood in the urine that could be growth in the bladder needs to be excluded. So it's very important to report it. Keeping well hydrated is very important for general health and for the health of the kidneys and other parts of the urinary tract. When a person sees blood in their urine, increasing their fluid intake, whether that be water or other fluids, will help dilute the blood in the urine, and it can prevent it from coagulating or congealing, which can cause problems in the passage of urine or emptying the bladder. So if a person does see blood in the urine, again, an important message here is to report it to a health professional, but increasing their fluid intake will certainly help while they're waiting to be seen or seeking advice. Most blood of the urine will settle on its own. That doesn't unfortunately mean that there's no underlying problem. A lot of the patients that I see in my clinic, for example, with the problem of visible blood in the urine, will report seeing blood either for a day and sometimes for a few days, and then it had disappeared on its own. That unfortunately doesn't mean that there's no underlying problem. So the important message here again is to report it to a health professional to be investigated. My advice for any man or woman who sees visible blood in their urine, or they've had a urine test that detected blood, is to seek medical advice. Although the majority of the time we don't find anything very serious, but the importance of reporting it is to exclude serious underlying conditions such as cancer.